Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Ever wondered how anthrax, a major health concern, originates? At the root of anthrax is a bacterium known as Bacillus anthracis. This bacterium produces spores, a form of the bacteria that can survive in harsh conditions. These spores, so minute they are invisible to the naked eye, are found in soil worldwide. Now here's where the chain of infection starts. Animals grazing or foraging in these soils can ingest or inhale these spores, leading to an infection. Humans, in turn, can get infected through exposure to these infected animals or their products. This could be through handling products from infected animals such as wool, hides, or hair, or by consuming undercooked meat of infected animals. It's also worth noting that certain occupations like farming, veterinary medicine, and others involving close contact with animals or animal products are at a higher risk. So the chain of infection starts from the soil, moves to animals, and then to humans. What if you were exposed to anthrax? Would you know the signs and symptoms? Let's dive into the different forms of anthrax, each with its unique symptoms. Cutaneous anthrax, the most common type, often starts as a small, itchy bump, reminiscent of an insect bite. Within 1 to 2 days, it develops into a painless sore with a characteristic black center. Inhalation anthrax, on the other hand, can feel like a common cold initially, with mild fever and cough. But within several days, the symptoms can progress to severe breathing problems and shock. Gastrointestinal anthrax might present with nausea, loss of appetite, bloody diarrhea, and abdominal pain. It's often mistaken for food poisoning. Then there's injection anthrax, which can cause redness and swelling at the injection site, often accompanied by multiple organ failure. Bear in mind, symptoms can vary widely and can sometimes take up to 60 days to appear. Being aware of these symptoms can help in early detection and treatment. If you suspect anthrax, how would doctors confirm it? Your mind may be buzzing with this question. The answer lies in several diagnostic tests. A blood test is often the first step, checking for the presence of the anthrax bacteria Bacillus anthracis. For skin anthrax, a small portion of the suspicious skin lesion may be examined under a microscope. But what if anthrax affects the lungs, you ask? Chest X-rays or CT scans can help detect inhalation anthrax by revealing any abnormalities in the lungs or lymph nodes. In certain cases, stool samples may be analyzed if gastrointestinal anthrax is suspected. Let's remember, time is of the essence when it comes to anthrax. Early diagnosis can significantly improve the chances of survival. The right diagnosis guides the appropriate treatment, whether it's antibiotics or other medical interventions. So, in the battle against anthrax, diagnosis is key to effective treatment and recovery. Is there a way to prevent anthrax from infecting you? Thankfully, the answer is yes. There are several measures you can take to protect yourself from this potentially deadly bacterium. Firstly, vaccinations are available for those at high risk. This includes veterinarians, laboratory professionals, and individuals who handle potentially infected animal products. This vaccination is a powerful tool in the fight against anthrax. Secondly, safe handling and disposal of products from infected animals is crucial. This includes wearing protective clothing and ensuring that any materials that come into contact with the bacterium are properly sanitized or destroyed. Lastly, if you've potentially been exposed to anthrax, post-exposure prophylaxis can be used. This involves taking antibiotics to prevent the bacterium from multiplying in your body, even if you've already been infected. Remember, it's not just about protecting yourself, but also those around you. By taking these steps, you can help prevent the spread of anthrax. Prevention is always better than cure, and with anthrax, it's no different. Once diagnosed with anthrax, what's the next step, you might be wondering? Well, the journey towards recovery begins. The mainstay of treatment is antibiotics. Medications such as ciprofloxacin, doxycycline, or amoxicillin are typically administered to combat the bacteria. The sooner the treatment begins, the better the chances of a full recovery. However, in severe cases, more intensive care may be needed. This could mean hospitalization. In the hospital, patients might receive intravenous antibiotics and other supportive care to help the body recover. This could include hydration, pain management, and even respiratory support if needed. Remember, the key to beating anthrax, like many diseases, is early detection and treatment. If you've been exposed or you're experiencing symptoms, don't hesitate to seek medical help immediately. Despite the severity of the disease, with prompt and appropriate treatment, anthrax can be overcome, so don't lose hope. The fight against anthrax is one we can win. UMCC, your ultimate medical consultant connector.